Hello, everyone. Can you all hear me?
I can.
Okay,
Can you hear me?
I can hear you. Is this Mike?
This is Mike.
Okay.
Hey, it's Karen.
So we're trying a different system today. Um, Hoping this will help for the folks that just needed to call in. So just want to thank you all for joining us and being on time. It looks like we are going to need one more board member to join to have a quorum to vote. And I think, at least if everyone who told me they weren't going to be here isn't here, we should be fine. I know Jesse had another meeting and is running a few minutes late. So I'm going to go ahead and get started with welcome and introductions, and then hopefully when we're reviewing priority projects, we'll get into, we'll be able to vote on these action items. So if everyone can take a moment to introduce themselves and make sure we can hear you, that would be fantastic.
Hi, this is Karen Holt. I represent the Northeast Texas Homeless Consortium as well as the East Texas Human Needs Network, East Texas area.
Thanks, Karen.
My name's Mike Cagle. I'm Director of Veteran Services for Hill Country MHDD located in Kerrville. I'm also a member of the Hill Country Homeless Coalition also.
Thank you, Mike.
Hi, this is Julia Lash from the City of Brownsville. I'm the Program Manager for the CDBG and ESG grant.
Thank you, Julia.
This is Kelly Stallings with Connections out of New Braunfels and part of the Comal County Homeless Coalition.
Thanks, Kelly. Carol, I think you are in listening mode only because of where you are right now. Can you just chat so that I know you can hear us? If you're able to do that. Oh, there's Carol.
Okay. I'm not sure how, I can't, okay.
We can hear you, Carol. I just wanted to make sure you could hear us.
Okay, I didn't know. I'm outside in the rain, so.
Oh my gosh. Well, get inside, and if
okay.
if you need to talk, you can just chat the rest of the meeting.
Okay, well, I don't see a chat thing on this new format on my iPad, so I'll just be quiet and vote when I have to.
Okay. I'm going to go ahead and get started, and I'm going to leave you all unmuted. You can mute yourselves if you would prefer to do that. But I'm going to go ahead and get started with our current priority project. So some of these are things we discussed last month, but I just wanted to give you all an update. We are really close to completing our point in time and housing inventory count. I think most of you are aware that's all due to HUD on May 1st. This year has taken longer than normal because we are doing a significant amount of work making sure that all of our data across THN matches and making a lot of corrections to our setups in HMIS. Like I said, a really significant amount of work that is going to significantly improve our data, and we're kind of working with a few years of cleanup, so it's been a lot of work for staff. It's been a huge team effort, and I think the results are really going to show in our HIC and then our AHAR next year. Most of the community reports have already gone out. We're also working on a new balance of statewide report that we have never done before at THN, which I think everyone is going to appreciate. We're really excited about it. And so far, and this isn't for public knowledge yet, but it is looking like our total count for the balance of state is going to be reduced by around 700 people. So we will be getting all of that information out to you. Again, you all should have received your community reports already, and we'll get those up on the website as well soon. And while we're talking about websites, I'm not sure if you all are aware that we are redesigning our website and are going to have a new website within the next couple months, which we're also very excited about and hope it will be much more user-friendly and easier to navigate. So staff is also working hard on that. We just finished up our second round of Provider Connect workshops for the CoC program grantees. So the last week of March, I went to Corpus, Galveston, and Beaumont and was able to take some of our staff to the Corpus workshop. And I think, you know, just as I said before, with the workshops, we're finding a lot of, sorry, Craig is sending me like flight signals from across the room and I'm not sure what they mean. Okay. We're finding grantees are having some really eye-opening moments about things that they may or may not be doing with their CoC grants. And I hope that everyone has gotten the impression that we are here to support our grantees and making these necessary changes. Some of them are relatively new from HUD, and some are things I think THN just really didn't have the capacity to work closely enough with grantees on in the past. So that's something we're really happy to be doing now. Now that we've finished the second round of workshops, we're going to then follow up with our in-depth program reviews with each of these providers. And so that's really, again, examining their data, their annual performance reports, looking at how they scored in the last competition, and also looking at some reallocation that we need to do in the balance of state. Our 2016 TDHCA ESG NOFA is due, well, for applicants, it's due Friday. We, as a CoC, complete a portion of that application. It's called an Attachment A. I think some of you may be familiar with it. We received 18 requests for this round of TDHCA ESG funding. 8 of those requests were for new collaborations or agencies, and 10 were current recipients. So we did things a little differently with ESG as well this year. Really took a much closer look at proposed performance measures and are really trying to align those ESG performance measures with the CoC performance measures. TDHCA has set the bar pretty low. I don't know if you all are aware that TDHCA is working with CoCs to take on local ESG competitions for CoC geographies. So a couple of the Texas CoCs did that in 2015. Some of them did it this year. We opted not to do that yet because, again, capacity and the amount of admin money the TDHCA is offering for us to do that, it just wasn't possible. We know that this will happen eventually, and one of the reasons we are looking so closely at performance measures is we don't want providers and grantees to be shocked when we do take over and the expectations for those measures significantly increase. So it benefits all of us to start working on those now. And I know some of you were involved with requesting that Attachment A, and I wanted to ask if anybody had any feedback or wanted to make any comments about what that process was like. Any comments on ESG? All right, we'll keep moving. We are planning to have a debrief with ESG applicants on the process this year, and also just, again, to set up expectations for next year and to really start discussing the work we're going to be doing with ESG grantees over the next year. That's something as a CoC we really need to beef up at THN, and these conversations don't need to be happening once a year around application time. So we're very cognizant of that and are really looking forward to increasing our communication and support with our ESG grantees in this next year. So I'm looking at attendance and seeing we are still one short in order to do any kind of action items. So while we're waiting a few more minutes, I wanted to ask you all, was it helpful for me to send out an actual Outlook meeting invite? Was it helpful for me to send out a reminder this morning, which was the request you all had at the last meeting? Do you want me to go ahead and send out Outlook invites for the remainder of the meetings for this year?
Yes,
I
please.
liked it all.
Karen liked it all.
Yes, I think having it on our calendar and then a reminder, I think all of it's great.
I think so too.
Okay.
Yeah, because we're
Okay.
also busy. Yeah, because we're also busy. It helps us jog our memory, and then it pops up on our computer or phones. I just think it's a good idea.
Okay.
I agree.
Plan around the meeting time. We can plan our schedule around that, so that's very helpful as well.
Okay, that's great. Thank you all for your comments, and thanks. Kelly agrees as well. So we will send out meeting invites. They may or may not necessarily come from me. I may have some lovely individual in this room send them out, but it'll be very clear that it's a board meeting, and we'll make sure to send out invites for every meeting. I'll continue to send out a reminder the day of as well. And my apologies to you all. This is the first month I was not able to get an agenda out ahead of the meeting. I just didn't have time. So in the future, I will continue to do what I've previously been doing, and that's sending out the agenda the week before the meeting. So thank you for your feedback, and again, I appreciate you all being here. The problem is there were two folks I was expecting to be here that are not, and we are again in the same situation we were last month, in that we do not have a quorum and cannot take action on any items, which, my apologies to all of you and to all of the staff that is in the room, because again, this really sets us back. And I just want to have a discussion with you all on how you think we should handle this. I mean, I can continue the meeting. The items we have for discussion are really important ones that I really wanted everyone to be on the call for, to get feedback on. I reduced the number of meetings to also just try and be more aware of everyone's time and the need for monthly meetings, but I'm hesitant to go through all of these action items and do another online vote when I really think these things need to be discussed with all board members. So I'm open to hearing what your thoughts are, but at this point, I'm thinking we need to schedule a May meeting and go over these action items.
Yeah, I mean, I think we need to have a call, and maybe for the ones that aren't on the call, I mean, that aren't here today, maybe given I know y'all probably done some personal calls, but yeah, I mean, can all of this wait until May, though? I mean, should we try to do it sooner?
I mean, we still haven't heard on Tier 2 funding, so I feel like we have a little bit of time with the NOFA, but yeah, I mean, it can wait till May. I was really hoping to start working on some of this before then.
How
Wait,
many do we need to have for quorum?
hold on. Somebody just joined.
Yeah, that's what I was fixing to say. I just saw it. So we might have quorum now.
I wonder if it's Jesse.
There's somebody on here whose name's not showing up.
Hello, who just joined us?
Jesse in Corpus.
Yay, Jesse. We were just talking about rescheduling a May meeting because we weren't going to be able to vote. So thank you. And I know you had another meeting right before this, so we appreciate you joining us. So I'll wrap up board attendance for there. We do have some members that are not going to meet their requirement of attending 75% of meetings for this year, and 2 of those are 2-year seats. So Mary and myself are gonna be reaching out to those board members individually, but I cannot stress enough how important it is that we have you all at each of these meetings. You are all seated on this board for a reason, and we need your help to move forward with the work that we're doing in the balance of state. So I know everyone is busy, but it's so important for everyone's time for me to be aware if you're not going to be able to attend a meeting, because I can plan accordingly for voting. So without further ado, I am going to move on to propose policies and action items. So RPG structure for next year, just wanted to let you all know, this structure is new for THN. They started it in October of last year. One of the challenges, in the balance of state is we're not only trying to work with our grantees, we're trying to work with, 24 local homeless coalitions now and 216 counties. So getting to everyone and meeting everyone's needs is something we're really working on. We are looking forward to our increased planning dollars next year to be able to better support all of you in the work that you're doing. But as far as the RPG structure, one of the things we've discussed multiple times here in the office is that we feel like it would be really much more effective for the RPG if all of the LHC chairs and or presidents were the primary RPG reps. We still want to have potential secondary RPG reps for those with lived experience, but there's just been some concern that the stuff that we're discussing in meetings is not getting back to coalitions. And I feel like if we had all the coalition leads as reps, we could eliminate a lot of that. Some of you serve in those roles now, so I wanted to hear your thoughts on that.
This is Carol. Do you hear me?
Yes, ma'am.
Okay. I think that's a really great idea because the lead has to know what's going on.
Thank you, Carol. We think so too. We think so too.
Yeah, this is Jesse in Corpus. I agree with Carol. I think it would be a great idea to have all the board chairs from the LHCs a part of the RPG groups.
I think it's a good idea also. This is Marville.
Thank you all. Does anybody have any concerns about that?
Yeah, this is Kelly. I do. I think when you have the lead doing everything, then you run the risk, one, what if something happens to that lead? Now nobody has any information. And I think it doesn't encourage leadership at that local level if one person has all the leadership in all the different capacities. It would be helpful if we knew exactly what you want us to take back then we would be better at doing that.
Okay. No, those are good points, Kelly. I think we've found, like I said, that having folks that are not the LHC leads, again, the information is not, it's not getting back to the coalitions. I agree. I think we can do a better job at those RPG meetings of what we want to go back to the coalitions, and I think we're starting to do that. You know, I feel like at the coalition level, you all still have different seats and leadership, so I would hope that those other chairs, you know, however, I know every LHC is structured differently, but would definitely be in the know of the work that the chair is doing. And again, we still want to have the options for multiple RPG reps, and we could even look at changing, you know, that secondary member or third. I mean, it wouldn't be a bad thing for us to have 2 for every LHC, you know, and if that's a person with lived experience or that's the LHC chair and someone else from the LHC, I think that's fine. And we can work up a couple of different proposals for you all to review. Because Kelly, I see your point. I think what we would like to see is that at least one of those RPG seats is filled by the LHC chair. And we would still have options for, you know, non-chairs to run for the board.
Cameron, this is Karen. I always want to say I think it's a great idea. I know particularly with my two LHCs as well as others that I attend, but I'm not their RPG rep, there is a huge disconnect within the larger LHC group in the community of understanding how THN, balance of state, fits in together. You know, we try to discuss it and talk about it, but I do feel like that would be a real important key is if I mean, in particular, my opinion is you have the president, that be a requirement, honestly, to be part of those calls because they really need, they're the ones that lead the meetings and they're the ones that are able to inform the rest of the group. So I think it's kind of important for them to be in the loop there.
Thanks, Karen. Yeah, we agree. Like I said, we're not opposed to having additional seats, but we do feel like it will be an LHC requirement that the chair would be one of those reps. And it's like you said, you know, we can feel the disconnect when we talk with RPG reps versus LHC chairs, you know, versus even like coordinated access transition team leads. So I think also y'all are going to see the meetings start to change. We're really going to have, at least with the RPG, focus on, you know, and I know we've done presentations on kind of who we are and what we do, but really on the local level, what we are wanting to see you all doing in LHCs, how we can support you all in doing that. And with coordinated entry and the systems change work that we're doing, us all being on the same page is going to be so crucial. So thank you all for your comments. And like I said, I think what we'll do, and if there are any more, please feel free to speak up. I think what we'll do is work up a few proposals for the next meeting and have you all take a look at those before and then determine if we need to vote on them. Okay, if nobody has anything else, just wanted to also, and I'm not really sure why this hasn't been happening, but beginning our next meeting, we're going to take a vote to approve our prior meeting minutes. This is going to include ratification of our March meetings to include those online voting action items that we did. So when we finish this meeting, I'll send out those again along with the meetings for this meeting and the minutes for this meeting, and that'll be the first thing that we do at every meeting moving forward. Just wanted to let you all know about that change. And then I am moving on to uses of reallocated funds. So as most of you know, and pardon my screen here, you all as a board voted to reallocate our supportive services only projects. The CoC is no longer funding supportive services only projects. HUD's been moving away from this for a long time. The only SSOs that have been eligible for new funding have been coordinated entry supportive services only projects. We don't know whether that'll be an option with this year's NOFA until it comes out. So those two projects were both from Corpus Christi. The total amount of dollars for those projects combined is $267,972. What we're recommending that those funds be used for are, well, and we're talking about two things here. I'm going to talk to you about the SSO reallocation and then any transitional housing projects that may voluntarily reallocate. So for the SSOs, the CoC is recommending, and we, again, want to get you all's feedback, hear your concerns, and see if we can take this to a vote today. If not, see what information you all need to move forward with the vote. But our recommendation would be that any applications for this funding would be for Housing First permanent supportive housing for the chronically homeless, or rapid rehousing. And actually, I need to update that for families. It would actually be for anyone entering directly from the streets or shelters, youth up to age 24, and those fleeing domestic violence. And sorry, that rapid rehousing for families is from an old NOFA. So that's it. I mean, that funding would be available and it would be allocated to applicants with the highest score, and available to any agency in the CoC, existing or non-existing grantees. Does anyone have questions or concerns about this? And do you all feel like you have the information you need to vote and to take a vote on that today?
Would it be for that same area?
That, well, and that's so in the past, that has and has not been the case, because these projects weren't providing housing in Corpus. We don't feel like Corpus is losing any housing inventory, so we wanted to open it up to anyone. We could also look at adding additional points if a Corpus project applied.
And we're talking about next year's competition, right?
Yes.
Okay, good. Okay.
And I think the reason... I'm sorry, Jesse.
I'm sorry, go ahead. Okay, I was just thinking, yeah, of course, of a new organization possibly applying for a PSH project for the chronically homeless. So I've had I need to talk with y'all more just to get the details on a permanent supportive housing project and of course some guidance.
Okay, absolutely. So does anyone have any... I'm sorry, Mike, go ahead. Or was that Jesse?
No, this is Eric.
Oh, hi.
Yeah, I'm just able to join you for a little bit. I was just going to say that I just want to point out with the Corpus Christi folks, we've been asking for a couple of years for them to reallocate. So they've kind of been in the boat of the second column for those SSO dollars in the past few years. So I don't want folks to think that this hasn't been talked about in the past. It has. Unfortunately, we haven't been able to reallocate it. So I think it's just important to know the history there. That's all I want.
Yeah, and I think, and I know all of the board members on the line weren't on the call when we took the SSO vote, but we talked pretty extensively about the work THN had done, you know, in the past few years with those projects to help them reallocate, even, you know, to the point of hiring consultants to go work with those projects, and they've chosen not to reallocate to housing projects. So I think that also played into the decision about it really opening up those dollars to the whole CoC. We have lots of interest in new PSH projects, and specifically Housing First PSH projects. And aside from this reallocation, these reallocation dollars and the potential bonus, if there is one, that's all we've got for potential new projects. So I think we didn't want to limit those dollars, but like I said, you know, we're open to discussing if you all feel like we need to, you know, take more into consideration that these dollars are leaving the Corpus area. But I think the fact that there have been a few years of opportunities for these projects to voluntarily reallocate, and the fact that they were not providing housing are the reasons we would like to see the dollars open up to the whole CoC. But I'm happy to hear what you all think about that, and also, you know, it would make sense to me if you all wanted to add some bonus points for a local Corpus project.
Cameron, this is Julia. I'm curious, if you were to open it up to the CoC, would it be available to new applicants? Because in our area, our region, we haven't received CoC dollars for many, many years.
Yes, it would be open to new applicants. So anybody in the balance of state geography that wanted to apply.
Okay. Okay, I was just confirming. Thank you.
Mm-hmm. Does anybody else have any comments or concerns about SSO reallocation?
Cameron, this is Julia again. I think that because Corpus was given several opportunities to do the reallocation and they chose not to, I think it's fair to say that the application should be, or the funding should go to other communities that now have the capacity and willing to provide this type of service and are in need of this funding.
Thanks, Julia. Jesse, I don't mean to call you out, but this is your community we're talking about, so I definitely want to hear from you if you have concerns about this.
Well, of course, the two agencies that are losing funding, they're providing a very, very much needed service, and I'm sad to see that funding is going away. However, I've known that that these talks have been going on for years, and I also understand these agencies have been aware of it and should have been and should be. I would think they would have been planning for this to happen. It's just it finally happened. But I would like to see some of this funding stay in Corpus Christi, of course, for a new project. I don't see any of the two remaining agencies. I don't see a reallocation of funding or project type by next year's competition. However, just with Salvation Army, I've talked with on behalf of Salvation Army. I've talked with my executive director. Especially since we're in the middle of a capital campaign to build a new facility and double the capacity for families. I've talked to them, and we're talking to the architect to make sure we have the flexibility in place should funding change at some point and lean away from transitional housing, that we still have the capability of adapting and changing our structure to meet the needs of an SRO.
Thanks, Jesse. Yeah, and I
Okay.
think that makes absolute sense, and that's definitely, at least CoC funding, you know, the writing has been on the wall, and I'm going to talk more about transitional projects voluntarily reallocating. I guess, you know, and the tricky thing about this SSO reallocation is one, you know, we've got two CoC grantees that would have to recuse themselves from this vote, one of them being Jesse. So I think just need to hear from you all is one, do you all feel like we need to take a vote on whether, you know, there are some additional points awarded if a corpus project would apply or not?
Well, Cameron, just one more thing I wanted to add, and just to point out that Corpus Christi does not have any permanent supportive housing projects in place. So, and it's something that's very much needed. During our coordinated entry sessions, when individuals come in to our coordinated entry point, you know, it gives you an outcome of what program these individuals should participate in, and you know, more than half of the time it says permanent supportive housing.
Right.
So it makes it tough when that we don't have that type of program in Corpus Christi, but I think it's something good here.
I liked the idea of opening it up, but possibly giving them some kind of bonus if it comes from that region.
Thanks, Kelly.
This is Karen, and I agree with Kelly as well.
Okay, so I think, you know, knowing that, like I said, with all the information you all have, I agree, you know, there's no reason we couldn't add some bonus points to a corpus project if there was one to apply that met the criteria. And I think, you know, we would have to look at what that allocation would look like and our scoring sheet, you know, to make sure, you know, that the highest score and the best suited applicant got the funding, but that if it were to stay local, there could be a potential bonus. So knowing all of that, you know, I guess I'm wondering if anyone feels really strongly that there should not be any bonus points for a project coming from Corpus.
This is Mike. Is this the same thing? Are we trying to reverse what we voted on last time? I'm a little confused here.
No, we voted that those SSOs would not be able to recompete in the next competition. So now we're voting to determine what we're going to do with those dollars.
Okay. But if they're not going to be able to compete, then it's showing, and please forgive my confusion here, what I'm hearing is it sounds like we're going to vote against what we voted for, but we're not.
No. So we're not saying that Corpus can't compete. We're saying those projects cannot reapply for supportive services only grants. No one is going to be able to apply for those in the balance of state unless it's associated with coordinated entry and it's in the NOFA. So we essentially voted to no longer fund supportive services only projects.
Okay.
Does that make sense, Mike?
It makes a little more sense, yes.
Okay. So, okay, I'm not hearing anyone vehemently opposed to offering a bonus to Corpus. So I'm going to hold a vote on that, and we're going to look at our score sheet and figure out what we want to propose to you all as far as an additional bonus if a Corpus project were to apply. Does that sound, are we all on the same page?
Sounds good.
Sounds good.
Okay.
Sounds good to me.
Thank you all. So for transitional housing projects voluntarily reallocating, so one of the things we're doing as we do these Provider Connect workshops and we're doing our project reviews is really taking a look at our transitional housing projects and which ones we need to look at reallocating. And that's really based on their direction HUD not even is going anymore, has gone. And we're essentially trying to catch up at this point. So as THN and as the balance of state, we're not saying there is not a place for transitional housing, but HUD is looking to fund permanent housing through permanent supportive housing and rapid rehousing. One thing we have a lot of in the balance of state, and these are the projects we need to start first with, and they're also going to be the most challenging to reallocate, are transitional housing projects that are really dormitory style shelter. We want to take care of this with those projects and work on a plan for them before HUD comes in, and we don't have an option to do that. So again, we've got quite a few of those. We're working with them individually. It can get complicated, especially if there's brick and mortar involved and there's not an alternative funding source for that brick and mortar. So over the next 2 years, we're going to be doing a lot of reallocation from transitional housing to rapid and permanent supportive housing. We're going to do everything we can to work with projects to come up with a viable plan for them to do this. We're going to be working on a timeline in the balance of state to determine, who is going to be ready to reallocate when. So for those projects, any of those new projects would be for Housing First, permanent supportive housing for the chronically homeless, or rapid rehousing for homeless individuals or families entering directly from the streets, shelter, youth up to age 24, and those fleeing domestic violence. We want communities, and this is again where LHCs come into place, to really help projects determine what the greatest need is in that community for this reallocation. So I will just give one example. We have a project in Abilene that is a congregate style living transitional housing project. It's actually a little more private than some of our shelter-based transitional housing, which is what we as a balance of state are most concerned about, but they're looking at alternative funding sources to turn that into a shelter and then reallocate to rapid rehousing so that they will have permanent housing to move folks out of the shelter into. And again, I realize resources are different in different communities. Scattered site transitional housing programs will have a much easier time reallocating to rapid rehousing than a brick and mortar based or, a Salvation Army, which we have several transitional housing projects that are housed within Salvation Armies. And again, not saying those projects aren't needed or being operated well, but it's shelter, and that is not what the CoC wants to pay for. So for those projects that voluntarily reallocate, they will have to submit a new application. They won't be recompeting for their funds. It will be for the same amount of their previous grant. They'll be competing just like every other grantee and at risk just like every other grantee is every year, but they will not be recompeting for those dollars for their project. Does that make sense? So if you had a transitional housing project and you were getting funded at, say, $267,000, when you apply for rapid rehousing or PSH at $267,000, no one else will be competing for that $267,000. Does anyone have any questions about that?
So this is not a split then. Is this a for that allocation of the 267,000, that would be for a full amount for that one entity?
I was just using that dollar amount as an example. It could be for one entity. It could be for multiple. It just depends on what kind of applications we get.
Okay.
So kind of go, just unclear. So say, you know, Salvation Army were to, you know, we got 275,000 from, you know, for continuum of care grant, and we were going to reallocate, you know, 70,000 of it towards rapid rehousing and keep the other 200,000 in place for transitional housing. Or there's a possibility of that?
Yeah, so that we would not be able to split a grant like that. The entire grant would need to be reallocated.
Okay, got it.
And Jesse, I know we'll talk about this in depth when we do your project review. And like I said, we want to start having these conversations now so this isn't a surprise. And again, we recognize this is going to take some time and planning and thought. I think we've got 2 transitional projects that will probably very likely reallocate this year to rapid rehousing. They're in the Killeen and Temple area, but they are scattered sites. So it's going to be a pretty seamless transition for them. And we're going to take into consideration, again, what everybody is looking at funding-wise, what kind of project they're currently operating, if there's brick and mortar involved. So again, this is not going to be simple or fun, but it's absolutely necessary. And like I said, we want to do this as a CoC before anyone else tells us we have to. And again, this isn't an action item, it's not a vote, it's just something I wanted to make sure you all were aware of, that we're actively working on and talking to individual grantees about the best possible option for them. We're also getting really close to being done with our written standards, and you know, there are certain CoCs that the majority of them actually, who have said we're only going to do transitional housing for these specific populations, and that's typically youth and domestic violence. Some is for families. I feel like in the balance of state, it's a little more challenging to do that because each of our communities is so unique. So written standards are something we're going to be working with you all on, having you all review, as well as the RPG. I don't think we're going to be able to do things, well, we can't do anything like most CoCs, right? It's just not black and white. We have to take into consideration our local communities. So we're going to be, again, this is another reason for the RPG changes we discussed, working really closely with the local coalitions and the communities and the grantees to figure out how best to make these decisions and ensure that your funding stays in your communities, but that it's for permanent housing, be that permanent, supportive, or rapid rehousing. Any questions or comments on reallocation? Okay, so just to wrap up, what we are going to do internally is look at our scoring sheet and determine what kind of bonus we feel like we could potentially allocate to Corpus projects who end up applying for these SSO dollars, and then we'll come back and present that to you all. So having said that, I am going to move on to the next item on the agenda. What you all are looking at is the Continuum of Care Lead Agency MOU between the Texas Balance of State CoC Board and the THM Board of Directors. This is an annual requirement of HUD that we have to have this MOU signed between those two entities. I'm not going to read this word for word for you all, but it essentially outlines the responsibilities of the CoC. So it details governance and participation in the CoC, the collaborative applicant designation. This designates THN as the lead collaborative applicant for the Texas Balance of State. It also gives us the lead agency designation. It gives us the HMIS lead agency designation. The next section is just general understandings about the CoC, HMIS, compliance with HUD, use of our planning grants funds, and HMIS financial support. We then go into the CoC responsibilities. And again, it just goes through our responsibilities as a CoC under HUD. So working to secure funds and resources for THN, within our work plan, developing and updating an annual governance charter for the CoC, establishing a board to act on behalf of the CoC, using a written process that is reviewed and updated every 5 years. It designates you all as the primary decision-making group through the board and us for to allow THN to act on behalf of the CoC. It goes into our operations, our meetings, talks about our collaboration with ESG. Like I said, I'm not going to read every single line of this to you all. It goes into CoC planning, talks about the board, it talks about the RPG, ad hoc committees, which currently don't exist in the Balance of State, which we are going to be talking about at our next meeting. Talks about the program application, again, details with the lead agency, our point in time count, our performance evaluation and targets that we establish as a CoC, and then collect and report on HUD through the AHAR. And again, more details on collaboration with ESG. We do not have, and y'all are looking at last year's MOU, we do not have chairs on our CoC board. So we need to take a vote, and that's actually, it looks like that's the only vote we're going to be taking today, to assign somebody as an authorized signatory for this MOU. I didn't send this out to you all because we need to update it, and I'll send it to all of you for your review before anybody signs it, but we need someone to sign it. So I wanted to see if anyone would be willing to be the authorized signatory. This is not for all BOS CoC board documents. I think also we probably need to have a discussion about our board structure. But for now, I need someone willing to be the signatory on this updated MOU, which again, I'll send to all of you for your review. Not a whole lot will change in it from last year. Again, this includes all of, the HUD requirements. So there's not a whole lot of flexibility with it. Of course, we will answer any questions or concerns you all have. But what I wanted to make sure we did today was established and voted on someone willing to sign once this is reviewed by you all. So before anybody makes a motion, is anybody willing to volunteer? Which will make a vote really easy.
This is Mike. Can you hear me?
Yes, sir.
I apologize. We had an internet disconnection and a phone disconnection for about 5 minutes. I'm just now getting back, so I missed it.
Oh, I'm sorry. We were reviewing the very broad review of the Continuum of Care Lead Agency MOU between this board, the Balance of State Board, and the Texas Homeless Network Board. So we're required by HUD to have this signed and on file by each of our boards every year. This allows us to continue our work as the lead agency for the Continuum of Care.
Okay.
With that, Cameron, I would.
Where did she nominate her? So we actually have a nomination. Karen, are you still with us? Is she still on? Oh, I'm sorry. Carol, are you still with us? Oh, Carol
I'm
can't.
here.
Oh, you are with us.
I'm here.
So you've been nominated.
For that. But
I
that's,
was actually going to I was going to nominate her also, but
Well,
I didn't speak up.
I mean, I'll do it if you need somebody.
so can someone make a motion that Carol be the authorized signatory for the balance of state representative on the MOU between the balance of state board, the CoC board, and the THM board?
This is Mike.
I make a motion.
Okay, so
I second.
Jesse's made a motion.
I
Mike
second.
seconds.
This is Karen.
Mike second, and then all remaining votes, you can either speak, please say your name, or type in the chat box. Julia?
I'm here. Yes, I vote yes.
Okay. Who are we missing? And Carol can't. Okay. Thank you all. Carol, you're the lucky lady.
Yes. Get with you.
So I'm just going to kind of review and then we'll go to Q&A. We are going to send out to you all a proposed some bonus points for any corpus projects that apply for the SSO funding. And then at our next meeting, we will review that and go ahead and take a vote to confirm that that funding will be open to any agency in the balance of state to apply for. We're also going to look at some different possibilities for RPG structure. It will allow for LHCs to have multiple members representing them, but one of those being the LHC chairs. I'll be sending out meeting minutes. We're going to start reviewing those or just approving those at every meeting. And I will be sending out to all of you a draft for the updated MOU between THN and the balance of state. I will give you guys probably maybe a week to review that. Would like to get that done as soon as possible. And then once we've received all feedback, if there are no concerns, we'll be sending that to Carol to sign, and then Eric will take it to the THM board.
Okay. Sounds good.
Does anyone have any other questions, comments, concerns, anything balance of state related that you would like to share or discuss or ask us about? Okay. Thank you all for your time today. Also, we're going to be sending out those Outlook invites for all of our upcoming meetings. I hope that that will be helpful, and we'll continue to also send out a reminder a week prior to and the morning of. And just want to thank you all for your service. We could not do this work without you, and y'all know where to find us if you need us. Okay,
Thank you.
Have a great rest of the week.
You too.
Have a good day.